let's talk a little bit, just a little tiny bit, about the THC and about the CBD. See what's the difference. How can we use them, and how do they act with the cannabinoid system? Let's talk first about the THC. The THC is the psychoactive one. We all have heard about it. We know that most of the products are really controlled drugs because of the proportion or the levels of the THC. So that means that we really need to know how it works and what it does in order to be able to use it. So the THC interacts with the CB1 and the CB2, and it's partial agonist. It means that it's capable to attach to those receptors very easily. And when it attaches to those receptors, it has different effects. And some of the effects that it has are mainly on appetite. It does have an antiemetic effect, which is very interesting, especially if we join that effect along with the appetite one. It does have some control of the pressure in the eyes, intraocular pressure. It does have anti-inflammatory effect. We've seen that in fact, it does have a very, very high anti-inflammatory effect. It does work on acute pain, on chronic pain. It does help to control spasms. It does help to control neuropathic pain. So when we are looking forward to use the THC, and we know that we have a problem or an issue regarding pain and inflammation, a lot of pain and a lot of inflammation, we might think in a THC as a proper product or molecule to be used. We'll have to know how much we're going to use and how to use it. But the truth is that we can think about it. And also when we have an animal that doesn't have too much appetite, it's not eating very well, he's feeling really, really low, he's vomiting, and he doesn't want to interact very much because he doesn't have any strength anymore. That's a molecule that we can think about. And regarding the CBD, that's the not psychoactive molecule. We have to say that it does help to reduce the THC side effects. So that's a good thing, because as we were saying, we can combine both of them and probably have a better benefit by using them together than if we use any of them alone on their own. The CBD does also have some anti-inflammatory effects, some analgesic effect. It also has some anti-epileptic properties. Is nowadays used in kids with these problems, and is further being used in animals with these problems. It also has some anti-asthmatic properties, which I would love to talk about it a bit later, in order to see how to use it. And it obviously has some anxiolytic effects and some neuroprotector effects. So as we can see, even though one is psychoactive and the other one is not, and even though they might have different benefits, we can combine them together and have a better result within our issues. And if we combine them both in a special way, we can even reach higher goals than if we use them sometimes independently. By saying that, it helps us focus each one of them depending on the problem that we have, and being a little bit more specific of what we want to reach.